Hi everyone, it's Tanya Tracy with Flow Physical Therapy and Pilates in Asheville, North Carolina. And after last week's technical snafus that led to no feature area Friday, I'm back. So today's feature area was inspired by a conversation I had with another healthcare professional about women's health. And before you men stop watching, it is not just a topic that pertains to women only that I'm going over today. This is something that does affect men as well. It just comes up more more frequently with women. So the feature area is the abdomen. And more specifically, the topic we're talking about today is something called Diastasis Recti. So what that is, it's where these long up and down muscles called the rectus abdominis start to pull away from each other. And this happens most commonly after women have their babies because everything has been stretched out to its maximum for quite a while. So they stay stretched out. So basically, these two muscles are connected by this tissue right here called the linea alba, which is a piece of fascia. That fascia also gets overstretched or over lengthened and can thin out a little bit, which makes these muscles separate away from each other. When that happens, your abdomen's not as stable or as strong as it was before. So functionally, it doesn't help your arms and legs have a stable base to move from. So again, this is seen with women, and typically the OBGYN, the midwife, or sometimes a physical therapist will catch this. But as I said, it's not just a women's health thing. This happens with men as well. And I've seen it, I've worked on it when I have had male patients sent to me for back problems, hip problems, pelvic problems. I'll see this when we're going to do the abdominal work, to the point that I've started to check for this with a lot of my male patients when they come in, to make sure it's not something that we need to address. And this doesn't necessarily mean that you had too big a belly. It doesn't mean, the other misconception is that somebody's abs were just so strong that they couldn't flex. It's not that stuff. So anyway, so anybody can have this, man or woman. So it is important to be able to address it so that we can get function back to that space. So I'm going to show you my postpartum belly. This is 6 years postpartum, and I had a diastasis that was 3.5 to 4 finger widths apart. So ideally normal for the space between these abdominal muscles should be 1 to 2 finger widths apart. After pregnancy, that typically is a little bit bigger. But again, it's not considered technically clinically significant until it's greater than 2 finger widths apart between the inside edges of these two muscles. That's the point at which typically you would have a referral to get some physical therapy, or if it's really big and there's no control of that area, sometimes they recommend surgery. That is a different topic in itself. So I'm going to show you how to screen for this in a moment. The places you're going to be feeling with your fingertips, you can either spread them out along that midline, again that linea alba, when you do your screening, or you can take your fingertips and check multiple times with the action I'm going to show you for the screening activity and feel for how much space is between them. I will say the most common space, and you can kind of see it on me as well, is the belly button. It typically is the widest spot. It's normally the last one to close up or to heal. And these things don't always completely close. They don't always go back to 100% normal. And we're not really looking for that. Even though visually it might look nice to have that back to normal, what we're looking for is, can we functionally control how far apart those muscles spread? So that's the key, is can we functionally control it? So I'm going to pause. I'm going to get in the position to show you how to screen for it, and then I'll also show you a very basic way to work on treating it. Okay, So we're going to be on the floor, on our backs. And again, the way we're screening for this, we're taking our fingertips and either putting them along that center line, or you can do the thing where you feel with your fingers vertical. So what we're noting first is you're just pressing on that midline, on that linea alba, and you're taking note. Does it feel kind of like the stiffness that you get when you press on the tip of your nose, or a little bit like silly putty? You know, it should have some resistance, but a little bit of give. If you feel like you can really just sink those fingertips, and we're not like pressing hard, just till you feel some tension. If you're feeling like you're sinking, chances are it is a little bit stretched out or over lengthened. So again, we're feeling this line, and you can feel on either side the muscles, which are the rectus abdominis. So the next step to screening for this, you're going to tuck your chin, and you're just going to lift your chest up. When you do that, these muscles will bulge, and you'll be able to feel that space in between the muscles a little bit more easily. So this is the point where you're checking. How many finger widths do you feel through there? So you can check with just one lift, or if you want to go multiple levels, you can do it multiple times to check and see what that feels like. So that's the first step. That's just a check to see if you have a diastasis recti. The next step is to see, can you control that diastasis? So can you keep those muscles from spreading out so much? So the way to do this, we talked about contracting the transverse abdominis in another video. So again, you're going to feel like you're taking these lower abdominal muscles, the transverse abdominis, and tightening them up, or like you're trying to draw these two pelvic bones towards each other, or like you're trying to hug your bladder, any one of those things. And you're also going to tense up your pelvic floor. So when you do this, you're going to hold the contraction. Same thing, tuck your chin and lift and feel. Does it feel same or different between your fingers? Is that separation the same, or have you kept those muscles a little bit closer to each other? They may not be normal, that 1 to 2, but if you're going from having 4 finger widths between and you drop it down to 3 or 3.5, then you're controlling that diastasis. So we want to work on that control. So that's how you screen for it. And if you think you have it, it's a good idea to go in and see your healthcare provider and ask them to officially diagnose it for you and get you some treatment. The thing you can do in the meantime, those same transverse abdominis exercises that I showed you 2 weeks ago, you can use those contractions just to start working on the strength through here. And when you do it, it's about 30 a day that you want to get, 30 repetitions where you're tightening it and then you're relaxing it. You do those off and on, squeeze, hold it for a little bit, and then relax it. When I first started doing these, I would set an alarm at bedtime so that I could focus on getting these and have a time of day to do it. Otherwise, it never got done. So once you get pretty good control of this and you're starting to feel stronger, you can check that diastasis recti. I would give it like every week you check it. If you check it more frequently, it's probably going to be frustrating. So once you feel like you're starting to get a little more control, or if you start to notice that space through here is getting a little smaller, you can add some more strengthening to the rectus abdominis muscles themselves. So we haven't even touched base on those yet, just by contracting here. Now, the next step is to strengthen those rectus abdominis muscles. So you're going to contract your lower abdominal muscles, again, your transverse abdominis and your pelvic floor. You're going to tuck your chin. And just the same way that you check, that you screen it, you're going to use it for an exercise. So you're going to exhale as you lift your chest, hold, and then slowly lengthen back down, and then let it all relax. Contract again, tuck the chin, lift the chest, hold, slowly lengthen back down. If it helps you to monitor while you're doing these, by all means keep those fingers at the center. Same thing, tuck the head and lift. So, with those chest lifts, 2 sets of 8 to 10 is good. If you feel capable doing more, you can do more. Just don't go to the point where those muscles are absolutely fatigued, because you need them for the rest of the day. So over time, again, that distance between the muscles, yes, it's important, and it's a nice marker to let you know if you're getting better. But the other thing to just pay attention to is more functional things. Can you pick stuff up more easily? Can you get up off the floor more easily? Can you get out of bed without feeling like you have to do the log roll to the side? So these are things that are more functional, and what we're really after is function. Even though it looks nice to have it back to normal, really focus on the function, and that will help you feel a little bit better about what's happening down there. So I hope this was helpful. If you found it helpful, please like it, share it. If you know somebody who could benefit, by all means, please share it or point them this direction. And I'm on Facebook, LinkedIn, Instagram, Nextdoor, and I'll be on YouTube as well. So if you want to know more about what I do, my website's www.flowptandpilates.com, and I hope to see you again next Friday. Bye.